Namaskar everyone. Myself Dr. Deepthi Variku, HOD Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. I extend a warm welcome to all of you for this webinar on exercise physiology. I would also like to welcome the speaker and our today's guest, Dr. Garima Joshi, MSc in Exercise and Sports Physiology from GNDU Amritsar, currently working as Senior Physiotherapist and Exercise Physiologist and Center Head at Specialty Clinics, Gurgaon. Ma'am will be talking about exercise physiology. As we all know, exercise physiology is both basic as well as allied science that uses body's response to exercises to maximize human potential. It gives me immense pleasure to introduce Dr. Garima Joshi as a alumni of Dolphin PG Institute. It is great that we know her since her bachelor days and we know how hardworking she was. And I know she is currently also more hardworking and reaching to more and more stars. Now, not taking much of time, I know this is going to be a great session for our students to hear from Dr. Joshi as she will unwind the magic of exercise physiology. Now, not taking much of time, I hand over the screen and mic to Dr. Joshi. Once again, Dr. Garima, welcome and let us start the webinar. Welcome.
A very good afternoon to Dr. Dipti Varigo. She has been always a guiding force to me since my bachelor's. Now I would like to start my presentation. I would request authorities to please show my PDF. I am switching off my cameras for the presentation purpose. We will engage again at the last of the ending session. Is my voice completely clearly audible? So I will start now. I extend my acknowledgement to all my teachers and institute. Let's dwell into insights and expertise that I bring to the forefront. Looking forward to guide you through the topic today. Let's have very informative, energetic, and forward-thinking discussion today. Today's topic is optimizing human potential, the science, tools, and precision of exercise physiology in personalized health and rehabilitation. Next slide, please. Optimizing human potential through exercise involves a scientific interplay of physiology, cognition, and other factors. It is a synergistic relation that works together. It does not improve your cardiovascular health only, but it also strengthens you and your muscles. It also cultivates a neurobiological environment which is conducive to unlock full spectrum of human potential. Now, a question for the audience. Any of the students, do you play any sports or any physical activity? You can comment on the chat box. Dear students, any of you, do you play any sports or physical activity? I'm getting some comments here. Am I audible? Okay. So when we exercise or we hit a gym or we go for a run, our heart takes a center spot. Regular exercises marks our heart works more efficiently, it pumps more blood, and with each beat, it strengthens our muscles as well as improves overall circulation. Same, there are other markers too, which ensures that we are working efficiently. So, coming back to exercise physiology is a science of human performance under physical stress, and it's a relationship between physical activity and structure and function of human body. It studies how exercises changes our human physiology. Next slide, please. So, as I have discussed, muscular system, when we exercise, our muscle spindle strengthens, which improves our strength. And how can we measure strength? By measuring one repetition max and other tests. Now, when we exercise, the nerves releases neurotropic factors, and like cheerleaders, neurotropic factors promote new connection and helps our body to communicate better. It results in better coordination and balance. Exercises are like superhero for our lungs and respiratory system. It improves our lung capacity, which shoots up our cardiac output and our ventricular capacity. And it also makes our heart stronger. It makes you physically efficient. Next slide, please. So, in short, we become more hormonal balanced, we feel more energetic, we are more loaded on dopamine, serotonin, and other happy hormones, and our metabolic system also shoots up. It helps us to regulate post exercise recovery. So in short, when you exercise, it's a symphony of positive changes happening in muscle, heart, nerves, lungs, and hormones. So now, till now, we know when we exercise, these changes happen. But how do we calculate it? How do we measure what changes are going to be there in our body? Next slide, please. So for testing our exercise efficiency, we have something known as clinical exercise testing. Clinical exercise testing is a very sophisticated diagnostic modality designed systematically to evaluate one's physiological response to control physical exertion. It should be noted that these exercise testings are individualized and personalized. It's different for patient and it's different for a sports person. So methods includes monitoring of key parameters such as heart rate, blood pressure, oxygen consumption, ECG monitoring, etc. By doing the testing, we gain insights for cardiovascular, respiratory, metabolic functions of individual. This helps professionals to formulate precise exercise prescription tailored for the patient's needs. It provides a scientific foundation for optimizing individuals' health and well-being. Picture this, there is a journey where every step affects not just today but tomorrow also. Looking into the short-term changes and long-term changes, we have to exercise accordingly. So clinical test monitors athletes in a different way. Please shift to the next slide. As you must have heard about sudden cardiac death. Sudden cardiac death is known as unexpected rapid loss of heart function, typically due to life-threatening cardiac arrhythmias occurring within an hour of symptoms onset. It is mostly associated with undiagnosed cardiovascular condition. So suppose there is an athlete or a normal person going to the gym without these clinical tests. He's running at his maximum heart rate and suddenly what happens? He collapses. How can we use clinical exercise testing to prevent that? It is mainly associated with undiagnosed cardiovascular condition. So for this particular concern, Athlete assessment program integrates clinical exercise testing and it provides insights on potential risk, which allow practitioners to have interventional strategies. Think of clinical exercise testing as a science story, like exploring how our bodies react during exercise. We have characteristics such as VO2 max, lactate threshold, and anaerobic powers. These key players keep telling about our health, lungs, and energy levels. This story helps coaches and strength conditioning experts and sports physios and exercise physiologists to just not have just a physical training program, but also to prevent any kind of abnormalities or potential death threats. So it's like getting into more insight about clinical exercise testing. I would like to shift to the other slide. Kindly shift to the next slide. So this is VO2 max. VO2 is our body's efficiency to use oxygen at maximum capacity. So as you can see in the diagram, there is cardiac structure, there is pulmonary function structure, there is muscle structure, and there is vascular structure. How can we correlate these? How can we correlate each of them to understand exercise testing better? So let's see. We did exercise. During exercise, our heart rate and cardiac output shoots up. It increases our VO2 peak, which is rate of oxygen consumption. The better the VO2, the better is your cardiac health and pulmonary functions. Now, if you look to the third figure, you will correlate it better. As I said, better the VO2, better is your cardiac and pulmonary functions, and in result, it better fuels your muscles and gets your oxygen extraction level to increase. Due to increased oxygen extraction, there is less time for body to get recovered, and there is more mitochondrial activity. And it also increases the vessels, and there will be more vasodilation, and there will be more capillary density present. So in result, it will definitely improve again your cardiac structure, pulmonary structure, and muscle structure. So these different things, different organs, they are not different, they are interlinked to each other. Your cardiac health will definitely affect your muscular and vascular health. Please shift to the next slide. On the other hand, we can see that reduced exercise or functional capacity kindly correlate to the last paragraph, deconditioning musculoskeletal disorder, that paragraph. On other hand, we can see that reduced exercise and functional capacity is seen in many disorders and diseases. For example, lung disease has reduced pulmonary reserve, which will affect lung capacity to carry oxygen, which will then affect your cardiovascular health and your cardiovascular output, which will result in peripheral skeletal dysfunction. In the same way, if you focus on the front diagram near to the lung disease, same way, deconditioned muscle and skeletal disorders will affect oxygen diffusion over periphery, which in turn will reduce your pulmonary efficiency. So everything is connected to each other, and clinical testings will give definite answers to the reduced efficiency or the bad performance of athletes. Kindly shift to the next slide. This is the diagrammatic interpretation of how everything is interconnected. Your circulatory impairment is connected to your ventilatory impairment, and then it's again connected to your cellular extractions and cellular levels. Kindly shift to the next slide. So students, till now, we have discussed about what is exercise physiology, why do we need it, how exercise changes our basic human physiology, how we measure these changes, and when not to measure the changes. As you know, we as a physios, we don't do test when the RP is too much or the strain is too much on the patient. In the same way, these clinical exercise testing have their contraindications. These are some of the contraindications given by AHA. You can take a look to the figure, take a minute to read the paragraphs and read the diagrams in brief. So for reduced pulmonary reserve, reduced cardiac reserve, skeletal muscle dysfunction, and other contributing factors, there are some or other kind of red flags. So we will not do clinical exercise testing if the red flags are present in a layman, in a sports person, or in a general population. Kindly shift to the next slide. So let's discuss some of the very captivating and interesting things. How do we compare how exercises are affecting same kind of training is affecting you differently for acute and chronic phase? So you all must be knowing about endurance and aerobic sports. Picture this: there is a journey where every steps affects your long and short term journey. So in the first diagram, we are discussing physiological responses to acute endurance exercises. So how does aerobic exercises affects you? When we do aerobic exercise or endurance exercises, the acute response will be increase in neural activity, blood distribution will be increased, metabolism will shoot up. In our lung, ventilation will increase, blood flow will increase, and blood distribution will increase. In our cardiac system, cardiac output will shoot, coronary blood flow will shoot, oxygen consumption will increase, and blood flow will increase, resulting in changes in our hemodynamics. Our hemo concentration, oxygen content, and energy substrate will shoot up. When our blood will change, our capillary distribution will directly get affected. Our arterial dilation will be there, capillary pressure will affect, there will be increase in blood distribution, and there will be increase venoconstruction. This will directly affect your metabolism and blood flow. I'm specifically talking about organs, specifically liver and spleen. Due to these all changes, there will be changes in your musculoskeletal system. There will be increase in blood flow. There will be more muscular strain, resulting in hypertrophy at acute phase, and there will be release of stem cells. These stem cells will also help you to improve recovery. When we do endurance exercises for long term, that is for more than 3 to 6 months, there will be more changes in our body, but they will be different from the acute responses. So for long term adaptations, if we talk about human organs, how we adapt to the long term adaptations of endurance exercises, in our brain there will be increased neural activity, there will be increased blood flow, BDNF factor will be there, and in our lungs blood flow will increase, and specifically lung volume will increase, capillary surface area will definitely increase, which will increase our oxygenation, and it will affect our cardiac output. In a cardiac system, there will be more oxygen extraction, resulting in increased blood volume, increase in RBC size, increase in hemoglobin, and levels of circulating energy substrates will be too much. Then it will directly affect your capillary distribution. It will increase your oxygen extraction, but there will be differentiation in your metabolism. Your liver, pancreas, gut, and kidneys blood flow will surely increase, and the size of your muscle fiber will not increase with endurance exercises. Reason being, we need more energy for endurance exercises, so our carb load directly is in proportional to your endurance exercises. In this, all organs will get affected, just muscle hypertrophy will not be definitive. Kindly shift to the next exercises. Now, comparing to the next, our changes with aerobic and resistance exercises in our cellular level. If we shift to the diagram in right hand, we can see aerobic and resistance exercises and how both exercises changes our skeletal muscle structure. Just delve into this and see the changes. How does it changes our skeletal muscle? Resistance training induces muscle hypertrophy. It increases size of individual muscle fiber. This involves protein synthesis, microfibrillae proteins like actin, myosin change, and there will be also increase in number of your mitochondrial activity and glycogen storage, which will enhance your strength and your endurance. Look into the aerobic exercises, which is a little left to the diagram. When we see this, aerobic exercises will definitely affect your mitochondrial biosynthesis. It will enhance your cell's capacity for oxidative phosphorylation energy production. It will lead to more mitochondrial density, which enhances capillarization. This is the main uh, factor which will improve your blood flow to muscles, and it will result in more glycogen storage, optimizing endurance. So when we do resistance exercises, why there is muscle hypertrophy and why there is when we do aerobic activity, why there is just storage of oxygen and why there is more capillarization, we can see from this diagram. Shifting to the leftist diagram, as we can see how our different organ changes with aerobic and anaerobic activity. We can see when we do exercises, specifically talking about resistance training, nervous system is more affected, more than the aerobic activity. And muscle mass, muscle strength, and endurance will and anaerobic power will increase more with resistance training than with aerobic training. And bone strength will only increase with resistance training. So while designing program for our runners or endurance trainer, it is important to also give them some strength training, not just purely endurance exercise or aerobic exercise. Kindly shift to the next slide. So as in the first slide, I said that exercise physiology talks about the stress on human body, but that stress is physical. Now let me just differentiate quickly about what is the difference between acute exercise and acute stress. Acute stress activates your stress hormones, which is cortisol. But acute exercise also triggers your cortisol. But in long run, we have been observing that chronic stress will definitely increase your corticosterone, but chronic exercise will combat your cortisol. While comparing again acute exercise and acute stress, endorphin release is seen, but in acute stress, there is no endorphin release. In both acute exercise and acute stress, there will be sympathetic nervous system functions that will we will see increased heart rate, increased blood pressure, and increased synaptogenesis. But in long term, when we compare these changes, chronic stress will definitely not improve any of your function. It will suppress your growth factors, it will increase your insulin resistance, it will impair your memory function. But chronic exercises, which is chronic stress over your normal physiology, it will reduce your sympathetic nervous tone. That means it will help you to regulate your heart rate, help you to regulate your blood pressure, and help you to be more efficient. It will improve your vascular health, it will improve your concentration of growth factors, it will help you to have more glucose tolerance, and it will help you to regulate your insulin. It will help you to improve your antioxidant activity, and it will definitely improve your memory function. So physiological stress is better in chronic run, but psychological stress is not better in longer run. So try to be more physical active and try to induce this physical activeness in your patients or your sports. Kindly shift to the next slide. Now, this is a pictorial representation of a group athlete. So how do we know which athlete is doing better, or how do we compare using all this knowledge? I will say this is a guiding map to understand how athletes perform better in exciting world of sports. Here comes the umbrella term. Kindly shift to the next slide. Athlete profiling used in sports medicine. So this is an umbrella term, and it is a very beautiful and interesting concept. First comes the sports medicine, which deal with physical fitness and pre-competitive medical assessment PCMA. Then comes the role of sports physiotherapy, which deals with injury prevention, rehab, and return to sports. Then comes sports physiology, which we have already discussed. It examines your body, how your body reacts to exercises. To improve nutrition and energy system, we need sports nutrition. For movement analysis, we have biomechanics analysis and bioenergetics. It plays a drastic role in injury modeling and athlete performance check. To maintain and develop physical health, strength and conditioning department is there. It comes to play the role to improve your body composition. It helps balance agility, coordination, strength of an athlete. To have an optimal performance, we definitely need our athlete to be sharp and focused. To cross-check mental well-being and manage emotion, behavior pattern of performance, we will include sports psychology into this umbrella term. In conclusion, the pursuit of optimizing human performance transcends into a realm of athletes and holds paramount importance of a broader population. I trust you found the session insightful and engaging. For any discussion, feel free to reach out. Thank you.
Any question, please type it in the chat box. Students, any question, you can write it in the chat box, please. Meanwhile, Dr. Garima, please share any exercise plan or how to plan an exercise within the clinic or within the field. Hello, Dr. Garima, am I audible? Am I audible, Dr. Garima? I did. Hello, Dr. Garima.
Hello, am I audible?
Yes, you are audible right now.
Okay. So I will give a brief comprehensive exercise plan based on exercise physiology. It involves a systematic approach. It integrates principles like specificity, overload, progression, and reversibility. I hope students will be able to grasp these concepts. These are basic principles of exercise physiology. I will repeat, those are specificity, overload, progression, and reversibility. So, suppose we have a patient of adhesive capsulitis. After doing its complete assessment, go with exercise plan which focus on these four parameters. So, let's assume we are assessing aerobic capacity, muscular strength, and flexibility because the patient is having shoulder injury. he or she will not be able to comprehend its health in such manner. So we will be assessing not just muscular strength but also other parameters. Considering the individualized aerobic and resistance training zones, we will also include periodization principles. That means we will not ask the patient to continually do exercise. We will also give some gaps between the training zone so that patient is having active recovery time. It will optimize the physiological adaptation necessary for sustainable fitness gains. Precision in exercise selection, intensity, frequency, and duration aligns with evidence based strategies for enhancing cardiovascular fitness, muscular strength, and overall metabolic health. So, this is how we design an exercise protocol based on exercise physiology principles. Students, I can read your questions here. You can type.
I don't think there is any question right now. Anything you would like to share about the experiences?
Yes. So I would share my experience regarding how this knowledge of exercise physiology helped me to be a better physio. In designing an exercise plan rooted in exercise physiology, we consider principles that I have discussed earlier. But it also helps me to structure a variation in training volume and intensities, and it prevents me to have a very platers and boring exercise plan. Additionally, it helps me to understand the individual's biomechanics aids better, and it helps me to engage in a optimized muscle training program. It helps me to design a injury risk assessment, which helps the patient to reduce any kind of risk of injury. I integrate my knowledge with these specific principles and assessment to form a foundation for an effective and personalized exercise regimen. My main interest in rehabilitation program has been of women health, and I am currently working more on the female patients of age more than 40 years, basically having any kind of musculoskeletal affections. My area of interest is more of women health, and that too comprehend more of the musculoskeletal ailments.
Any question anyone want to ask? Please type it in the chat box. Okay, so there are no questions. So at the end, I, Dr. Diksha from DIBNS, on behalf of our management and physiotherapy department, extend a great thank you to all of you and to Dr. Garima. Thank you very much. Thanks to IT Cell for always helping us with the glitches. Thank you, ma'am.
Thank you so much, Dr. Diksha. Your intake has been really helpful for me, and I hope the students got better insights on exercise physiology. If they have any questions, feel free to email me the questions. I will interact accordingly. Thanks a lot.
Thank you.